Overall, what do you think that legalizing recreational use of marijuana has done for your student body?
I believe it's hard to tell right now what is going to happen in the future. What we see through studies and evaluation surveys that we are doing with our students here is that since legalization occurred, we've not seen an increase in usage. What we have seen is an increase in, or a change in the perception of risk for students. So students are perceiving that marijuana is less risky than they used to, but that has not equated into more usage. We're not exactly sure why that is. And long term, I don't think that we really know what's going to happen long term.
What has been the impact of the marijuana related revenues in your district?
So for our district, we have been able to add additional health staff, both nurses and counselors, to work with students on substance abuse prevention and general behavioral health concepts. So we have been able to add nurses in our high schools that work directly on site with students doing prevention education and early intervention services. Our district has not had on-site school nurses before, so that's been a huge benefit to us. We've also been able to add some counselor time, even some specific time for counselors who have more addiction certification and experience that they can then work more long term, even with students who are identifying with more problems around substance use. And then overall, we're able to do more early intervention programs with students at school. And we're offering some of those as suspension reductions. So instead of suspending students for 5 days, we can provide them with early intervention services and reduce that. So they're getting education and getting connected. And if they need more services, we're able to refer them out.
What advice would you give us another state like Illinois that's considering going the route that Colorado went?
I would say to be very thoughtful on how other states have rolled this out and learn from their lessons. Uh, what I see is a very small part of the revenue that has come in, and how that's really been kind of provided to schools and to our public health departments. But I know that other states have done things very differently, and some probably are doing better work in some areas than others. So just to be very thoughtful on all of the work that's already been done and put into that.